Welcome to This is UIC Weekly, bringing you the top stories you need to know from the University of Illinois Chicago each week. It's Friday, August 16th. Here's the latest. Only a few dental clinics in Chicago offer dedicated support for patients with disabilities and complex health issues. That means finding a dentist for something as simple as a toothache can be extremely difficult for these patients. To meet this need, the University of Illinois Chicago College of Dentistry recently opened the Inclusive Care Center, thanks to a $2 million grant from Delta Dental of Illinois. Their focus is caring for patients with physical, developmental, sensory, behavioral, cognitive, or emotional conditions. The clinic opened in March and already has seen more than 500 patients. To make the space as comfortable as possible for patients, there are specially designed chairs, calming wall colors, weighted blankets, noise-canceling headphones, and a sensory room. The clinic also has a lift to treat patients in their wheelchairs. We commonly think of being under anesthesia as being put to sleep, but there are actually multiple parts to this state. Patients are sedated or asleep, and they can't form memories. Anesthesia means they won't remember the unpleasant experience of having a breathing tube removed after an operation, for example. New research by Dr. Michael Fettyplace of the University of Illinois Chicago and colleagues has demonstrated in rats that it might be possible to separate waking up from anesthesia and the resumption of memories. In other words, patients could wake up from sedation sooner, a good thing because sedation carries risks, yet their memories wouldn't start forming right away. The research is published in the British Journal of Anesthesia. The discovery helps researchers better understand how anesthesia works, and it could lead to improved patient care since sedation carries risks. Currently, there is no reversal drug for anesthesia. Doctors wait for the patient to metabolize the drug, and it slowly wears off. A new paper from UIC researchers explains how unusual structures called dome craters formed on the icy moons of Jupiter. In 1979, the Voyager satellite captured the first images of these mysterious craters marked by mile-high domes in their centers. They were observed on the moons Ganymede and Callisto but have never been seen elsewhere in our solar system. A team led by UIC graduate student Martina Kelsey and Professor Andrew Dunbard used computer models to simulate how the domes arise from another formation called a pit crater. They found that the unique conditions on these moons with interior oceans covered by a layer of ice made it possible for domes to form over millions of years of ice flow. Kelsey's expertise on the moons of Jupiter has led to a role on a NASA mission launching an unmanned spacecraft later this year to study Europa, which scientists believe may have the conditions to support life. UIC is Chicago's public research institution with a mission to provide the broadest access to the highest levels of research, educational, and clinical excellence. Visit today.uic.edu for these stories and more.